Well, we welcome back to the Rob Newton Resource Hour. Dr. David Klein, you know, when you listen to this show, you're hearing the best in the business. You got Dr. David Klein, you've got Robert Palmer of RP Funding, Wade Boyette of the BCN Law Firm. The list just goes on and on and on. And we're proud to bring you these people. We truly are. And guess what? There's a lot more of them down the line as we're adding more stations. Yesterday, if you were listening, the doctor addressed men and the problems that we men run into about the time we're 40 years old, when life's supposed to begin at 40. But for some of us, well, that's when things are a little bit harder to get started and, maintaining. So how about the women's side of the equation? Because they also go through this midlife crisis.
Oh, yeah. Oh, they sure do. In fact, women aren't the only people that really suffer through menopause. God knows we all suffer through it when it happens. And so the long and short of it is that women, by and large, on many levels, many ways, some good, some bad, are far more complicated than men. It's very, very easy to get a man's testosterone to estrogen ratio to correct itself.
Mm-hmm.
It does not take that long to do it, usually 3 to 6 weeks for men. Okay, if somebody's really abused themselves with diabetes and or cigarette smoking, it might take a little bit longer, but for the most part, it doesn't take long at all. Women, on the other hand, not so fast. Okay, they're supposed to shift their hormones up and back, up and down, on a monthly basis. Actually, twice a month it's supposed to happen. And when that stops, their physiology kind of falls apart in one way or another. So today what we're going to do is we're going to talk about the female gonadotropins. These would be progesterone, testosterone, and for the most part, estradiol. There are 3 different estrogens. We're going to focus on estradiol because the other 2 are not quite as important for purposes here. But it works something like this. All 3 of these hormones are essential. All 3 of them have functions, plural. There are many functions for each one of these hormones, and when they start to go wonky, lots of bad things happen. Well, as a woman gets older, her estrogen level will decrease. So will her progesterone, so will her testosterone. In men, the testosterone decreases, the progesterone decreases, but the estrogen goes up. So guess what? You end up with a bridge partner rather than a husband, and sometimes we can bring them around easily, but you'd better get around too, or there's going to be difficulties in paradise. So it works something like this. So as estrogen levels decrease, okay, your bones suffer, your heart suffers, which is why women have a tendency to develop osteopenia, which develops to osteoporosis long before men do. It is just a fact of life. Aunt Shirley over there is bent over like the letter C, where Uncle Charlie is standing up straight. They're both of the same age, but this is the sad fact, is that women have to pay closer attention to their estrogen balance more so than men do. So let's figure this out. Okay, you can take all the calcium in the world and not be able to treat your osteoporosis. You can take the most expensive calcium out there. You can take it until you're as hard as a rock from the calcium in your gut, and it will not make it to your bone, because if your estrogen and testosterone levels are not adequate, it doesn't get deposited and it doesn't stay there. So here's the deal. Okay, we have to do blood levels, not this saliva nonsense that the chiropractors and the wannabes want to do. If you see that, run. Okay, it means you're going to get ripped off. It means nothing's going to happen, and you'll end up several $1,000s lighter before anything ever comes of it. The blood levels are going to tell you what's going on. Estrogen, estradiol, testosterone, progesterone. You need each one. Well, what do these things do? Well, what happens when progesterone levels decrease? And that's about the first one that goes away. You end up with vaginal dryness. Well, guess what? You pick up magazines and you see all manners of advertisements for these intimate lubrication products. Okay, there should be an acronym, ILP, for these things, for God's sake. They're acronyms for everything else. But this vaginal dryness issue is something that every woman is going to experience because the progesterone levels go away. Well, after all, you don't really need progesterone anymore because you're no longer fertile. Well, that's absolute utter nonsense. Progesterone is an immediate precursor to cortisol. It's an intermediary precursor to testosterone and estradiol, and if you don't have any progesterone, you're not going to develop the others as well. So what do? We draw levels, look at progesterone. Well, what about testosterone? Why does a woman think she needs any testosterone anyway? Well, it's not a cyclical testosterone or hormone. It is actually something that it maintains a rather linear level in most women, but it's linear on its way down. You need to have a level between 50 and 70 to have any libido at all, and between 30 and 50 not to develop the osteoporosis that is destined to be in your future if you don't do this. So libido, testosterone. Osteoporosis, testosterone, progesterone, vaginal dryness. Well, what else? Estradiol. Well, if estradiol level goes to zippo, which is what's destined to happen as well, you end up with thinning of the vaginal mucosa. The cells that line the vagina tend to wither away, they thin out. Now you have painful intercourse. So what's the next step? Oh, let's give you transvaginal estradiol, as if the rest of the body doesn't need it either. It's kind of like if you have a fever and you really need to treat it, which those of you that know me well realize that that's not a good idea anyway. What are we going to do? Give you a sponge bath. It doesn't do anything for the infection that's causing the temperature, and giving transdermal estradiol does nothing for the underlying issue. So how do we fix this? You get your blood drawn, and then the replacement is key. You replace estradiol separately from progesterone, separately from testosterone, separately meaning that you adjust the dosage is different, but they're all going into the same transdermal product, which is used as a cream through the skin. If you know, or if the doctor knows what cream to compound and what base to use, that stuff will blow through the skin, like a dart through a basketball net. It goes in, gets the job done. We're able to do it very, very reasonably with our patients because we twisted some arms with a compounding pharmacist and got them a good break. We don't get paid anything, we don't get a thank you note, but our patients do well, and that in turn helps us out tremendously because they like me as a result.
How long does it take to get an appointment to drive up from Central Florida, where we're broadcasting right now on the Rob Newton Radio Network, around the villages, Leesburg, all that area up in there, and make it right on down? It's a short drive. It's just about exactly an hour to get to Longwood.
Well, the way I drive, it takes a little longer because I break for pedestrians. However,
I thought you ended up in Atlanta with your sense of
No, I
direction.
do that too. My sense of direction sucks. Somebody asked me on the air, what can be done for sense of direction? My response was, God knows I would be taking it myself. It doesn't take long at all. Once they get through the telephone system, which is a challenge for me and everybody else, it may be as long as 3 or 4 days. It could be a week or more. It doesn't take that long.
Well, that's not bad.
No, we get people in the same day sometimes if they're really desperate, and if they say please to my secretary. We don't make people wait. I work as late as I need to.
Mm-hmm.
That's sometimes very late indeed.
The other thing I really like about it, and I am one of your patients, I'll say that as a disclaimer, but I like the fact that I'm not the only one lucky enough to see you. When a patient comes in there, they're going to see you.
Yeah, it's just
they're going to get the attention.
Yeah, I don't have a bunch of people working for me that see the patients. Now, I do have nurses and nursing assistants that take the vital signs and get people settled in, but then you have to suffer through me to get any treatment, because we don't have anybody else as a buffer. I like it that way.
And as a precursor warning, if you don't know the doctor and you've never seen him on video, sometimes when you come into the waiting room, he's sitting right there with the people.
Yeah, well,
still don't understand.
If you can't goof on the patients, who can you goof on after all?
Robin, can you tell us how the people can get an appointment, and if they want to buy some of these nutraceuticals, they are available in a very simple form?
That is true. Well, the best way to get an appointment is to call the office at 407-679-3337. You can check us out on the web at www.stagesoflife.net. For our online store, when you're on our website at stagesoflife.net, just click on the Vitamins and Mineral tab. But when you do call the office, we are open Monday through Thursday from 8 to 5, and we will be happy to help you get that appointment as quick as possible.